Hi there. One of the commoner questions I get asked by men with post-prostatectomy stress incontinence is whether they should have a male sling or an artificial urinary sphincter. We know that about 5% of people having radical prostatectomy end up with some sort of surgical intervention for their stress incontinence, although that incidence has reduced, particularly in our experience, following robotic prostatectomy. So one of the first things really to consider is the level of expectation. Some people are very active, some people are less active, some people can tolerate a pad a day, some people can't. And I think therefore this is a very individualized decision. It's not something that is written down in the textbooks, and it is a discussion between the doctor and the patient as to what their expectation levels are and what the leakage level is. So the level of leakage also determines which option we tend to go for. There is a study underway at the moment comparing both of these devices, which will give us slightly more scientific answers to these questions. But at the moment, slings tend to be offered more in the milder end of the scale. Certainly from the early studies into male slings, the results were better in the milder end of the scale of incontinence. If you've had radiotherapy, then the results of male slings are not particularly good in that group, and therefore that really rules that option out. And of course, finally, personal choice comes into it as well, and I tend to show patients both of these devices and then come to a sensible decision between us in a sort of shared decision-making process. So let me show you the sling to start with. Here is one example. It's essentially a simple piece of mesh. They can either have two arms, or like this one is a quadratic sling with four arms, and it's inserted via a incision or cut beneath the scrotum in the perineum. And it's a fixed resistance. It presses on the urethra, it elevates it, and it compresses it. And it's thought to reduce leakage by increasing the resistance within the urethra to the bladder pressure. Now the advantages of this are it's very simple. It's a single incision. It takes maybe 45 minutes or so to insert, a single night stay in hospital, and healing is fairly quick after that. The other advantage is that once it's in and in position, it doesn't tend to break down or migrate, and in fact most surgeons working in the field of male health have not seen any significant amount of erosion like we've seen in the female population. Nevertheless, this device is under close scrutiny at the moment because of the problems in the female mesh world. So with the slings, the success rates approximately are in around about 60% of men having a male sling will either be dry afterwards or using one pad a day. It's very difficult in incontinence surgery to guarantee 0 pads a day because if the abdominal pressure is very high, such as during a sneeze or a strain, then it may overcome the pressure within the sphincter despite these devices. So overall, I tell patients that if they're having a male sling, they can expect maybe a 60% odds of dryness, and then a further 20% will be improved, and unfortunately around 20% will not be improved at all with the male sling. And that's the main disadvantage, really, that it doesn't work in everybody. So onto the artificial urinary sphincter. A lot of people ask me, what is that? Well, it's a slightly more complex device. It's a 3-piece device with a little plastic cuff that sits around the urethra, that's tied around like that, and squeezes the urethra. This is a more dynamic device. In other words, it opens and it closes as and when that's required. There's some fluid that's contained within a little reservoir that's placed in your abdomen, and then there's a little pump that sits in men. It sits in the scrotal wall, and when the bladder's full and you need to pee, then you give this a few squeezes through the skin. All of this is internalized, and it empties the cuff and allows you to void. So the advantages of this device is it's a more natural method in a way. It puts pressure on the urethra when it needs to, and then it releases it. So it's an open and close. And therefore, we can put some more pressure on the urethra, because when you want to void, then that pressure comes off. And by doing that, the success rate, or should I say the dryness rate, is higher. And certainly looking at my own series, around about 90% of people having this device fitted are either dry or using one pad a day. And a lot of these men will have been using upwards of 5 or 6 pads a day before the surgery. So they're a very grateful group of patients. The disadvantage of the artificial sphincter, obviously, it's a more complicated device. It can break down. It's more prone to mechanical breakdown. And certainly over a 10-year period, then we see maybe 30% of these having to be revised. And the average life expectancy, if you like, of this type of device is approximately 8 years before it needs revising. That's an average figure. So the advantages of this is it's more likely to restore continence, but the disadvantage is it may need further surgery along the line. Finally, there's a risk of erosion with this. If the cuff is too tight, then a small number, possibly 2% or so, will have damage to the urethra as a result of this device, and then it has to be removed, and then we're back to square one. So those are the pros and the cons of these two devices. So in summary, it really depends on the level of leakage to start with, the medical background, whether there's been any radiotherapy or not, and of course personal choice comes into it as well. And once we've got the results of the master trial, as I say, we'll be able to tell you a little bit more about how these devices compare. Anyway, I hope that's been useful in helping you choose or think about your continence solution. And as I say, keep watching these podcasts and YouTube videos for more men's health updates. Thank you.